Assalamu alaikum and good afternoon from Malaysia. First of all, I want to thank the organizers of this conference and particularly Dr. Imran Pasha for giving me the opportunity to talk to this august gathering of medical professionals. For next 1 hour or so, we are going to discuss about the assessment in online or virtual setting. Let me start with two very important opening statements. Students can escape from the effects of poor teaching. They cannot escape the effects of poor assessment. The second statement, assessment delivers a judgment which affects individuals and communities alike in both positive and negative ways. Therefore, it is of utmost importance that for a fair assessment, we must use valid and reliable tools. May I request each one of you to ponder on this statement, means the effects on individuals and communities of the assessment, the type of assessment. Let's think about it for next 15 seconds. Now, once we have our focus on the assessment, let's look at the learning outcomes which we plan to achieve in this session. The participants will be able to explain the principles of online assessment, discuss the process of online assessment, select feasible, fair, and cost-effective online assessment tools, utilize the existing facilities and tools more effectively and efficiently for online assessment so that we can reduce the cost, and manage the challenges arising during online assessment. The scope of today's presentation is to address the immediate concerns and the concerns relating to future planning of online assessment. Before I move further, I want to read this disclaimer. Not all the ideas or suggestions presented in this webinar are evidence-based. Before using any method or software, a trial run must be done to train the staff as well as students. And any teaching learning activities or assessment method that requires hands-on demonstration of skills cannot be fully replaced by online approach. Having said that, let's look at the principles of general assessment, not specifically online, but this is for general assessment. It should be fair, appropriate, valid, reliable, transparent, authentic, manageable, and engaging. However, for online assessment, we need some additional principles. First, of course, is validity, means whether the method we are using is assessing what we really want to assess. Two is reliability or reproducibility of the results, means a method is reliable and if it is applied in a similar situation at a different place would produce the similar results. Third is feasibility, again, a very important component of online assessment. And to assess the feasibility, we need to take few steps. First, we should divide the exam components into two groups. The components which can be done online and those which cannot be done online. And this should include both practical and clinical assessment. And this step would tell us that what are the components of assessment which can be used in online methods. Second, online. Synchronous means real time or otherwise. We can also have distant assessment offline as well, not necessarily face-to-face, for example, e-assignments. Again, we can have online assessment, remote as well as on campus. The method can be used even on the campus. And we have to be very mindful about the time zone if we have international students. So we have to cater for their availability and suit the time which suits them for that assessment. Fairness, of course, is very, very important, but especially looking at the online assessment, the most important component would be the comparable facilities. Means all the students must have similar opportunities and facilities. If some students don't have those facilities, either they won't be able to take part in the assessment or they would have problems. Equally important is the familiarity with the new approaches, methods, and technology. Both students and the staff members must be familiar with the methods being used or the software being used or technology being used for online assessment, and it must fall in line with the teaching learning methods. Academic dishonesty is a big issue in online assessment. Students should not be able to use any additional functionality of the computer other than the examination itself. Cost effectiveness, of course, a very important factor as well. Legal cover, yeah, that's again the any online assessment method which we are using must have a legal cover, like we have legal cover for our on-campus face-to-face assessment. It must be accepted by the stakeholders, especially the accrediting bodies, because they have to give approval for that. And everybody who is using this online assessment must be familiar with the implications of online assessment, what are its disadvantages and what are its advantages. The next point is robustness of the software. Again, a very important aspect of online assessment, the technical cover, the ability to recover from a technical failure, which is not uncommon, is one of the key issues of conducting online examinations, and disaster recovery must be planned in advance. Again, the impact on teaching, learning, and practice for future considerations. This means that if we are using online assessment regularly, how would it affect the teaching learning practices for future generations? And on realizing, very important realization that online assessment cannot completely replace face-to-face assessment. In other words, when we were talking about feasibility, we can identify the exam components which can be assessed online and exam components which cannot be assessed online, and maybe towards the end we have a combination of online and face-to-face assessment. Right, now gone through the principles and understood their importance, especially in relation to online assessment. Let's look at the conduct of assessment. The strategies for online assessment: we can use quizzes for better engagement, open-ended or essay questions, conducting drag and drop activities, case studies for improving skills, online interviews for building self-confidence, dialogue stimulation or simulation activity for communication, online polls for students' feedback, and gamification or game type exercises for better collaboration. Now let's look at the scope or application of online assessment following Bloom's taxonomy. The lowest level in Bloom's taxonomy is recall of facts and basic concepts. That's the remember. And normally face-to-face, we would assess this area by using multiple choice questions, structured essay questions or essays. And if we want to assess this area, online assessment, we can use online quizzes like Kahoot, Socrative, Mentimeter, Polls Everywhere, or Quizlet. The second level of Bloom's taxonomy, which is understanding or comprehension, or ability to explain ideas or concepts, is usually assessed by multiple choice questions, structured essay questions, extended matching questions, essays, and open book examination. And by using online assessment, we can utilize quizzes, Google or Microsoft Forms, or ExamNet or other similar softwares. The application of knowledge or use of information in new situations, which is level 3 of Bloom's taxonomy, is normally assessed by utilizing modified essay questions, problem-based questions, patient management problems, open book examinations, OSCE or OSPE. In online assessment, we can use quizzes, Google or Microsoft Forms, or ExamNet or other similar softwares. The next level of analysis, which is to make connections between ideas, is normally assessed by use of modified essay questions, problem-based questions, patient management problem, open book examination or OSCE, and if we want to use online assessment, we can use e-assignment, e-portfolio, or ExamNet or other similar softwares. The next level of evaluation, which is ability to justify or stand a viewpoint, is normally assessed by structured essay questions, extended matching questions, modified essay questions, patient management problem, or open book examination or OSCE. And again, for online assessment, we can use the tools like e-assignment, e-portfolio, or ExamNet and other similar softwares. The highest level of creation or produce new or original work is done by using community projects, research projects, paper publications, portfolios, videos, and literature. And if we want to use the online assessment in this area, production of videos by the students and submitting for assessment may be used. So this is how we can use the online assessment, and at the same time, we can comply with the Bloom's taxonomy for different levels of assessment. Now, how to plan, or what are the steps needed to plan an online assessment? The first, before the examination, we have to prepare the staff and the students for online methods of assessment. They must be familiar with the software which is going to be used. During the exam, we must use original materials, the pictures, data, radiographs, videos, ECG, etc. We should not borrow these resources from the internet because the students might be familiar with that, or they might have gone through that on the net. So we must use our original materials. After the examination, we must compare the results with formative and ongoing assessment. This is in a way of the security of the exam, that whatever results we achieved, the student have achieved, we must compare it with the previous results, including formative and ongoing assessment. We must check for plagiarism, and we may have to conduct viva voce, especially for students whose result is too good, or for students whose result is too poor, and for those who face internet problems during the process of online assessment. This is how we prepare for online assessment. For students, knowledge of academic ethics, especially the policy for dishonesty, and preparing them, the students, and teaching them about the ethics of appearing on online assessment, self-regulation skills. For teachers, they have to design effective curriculum and secure assessments, and they should be able to detect plagiarism while doing the assessment, and should be able to do manual proctoring, which I will elaborate in a short while. The institution needs to prepare or institute an integrity policy information, provide training support to teachers as well as to students, provision of optimum platform for online teaching and assessment, and the software or platform we are using, their provider must provide technological support for authentication, because we need to authenticate the students before they start their online assessment. Computer lockdown, proctoring, plagiarism detection, and data analytics, and most important, as I mentioned earlier, the disaster recovery. So this is the preparation for online assessment for students, for teachers, for institution, and for the software provider. We can summarize this in these steps as well. We have to have a system set up. We have to test the link sharing. We have to have the candidate authenticity. Then we conduct the exam evaluation and the report generation, and finally analyzing the results. Here is another way of looking at it: online course assessment cycle. The first one is student motivation. Now, student motivation for online teaching and assessment may need different approach as compared to face-to-face. So the feedback, for example, for them would be very, very important for their motivation. And also familiarizing them and convincing them for the honesty policy for online assessment. Student engagement and achievement is again a very important, and the gamification, for example, in teaching and learning can help in student engagement. Then, of course, is online assessment, and then the feedback. This feedback is very, very important, especially if we are using the formative assessment, because it would also help in motivating the students. Now, the assessment components, as usual, there would be cognitive components, there would be psychomotor components, and there would be affective domains. We will have written examinations, we will have practical or OSPE, and we will have clinical examinations and OSCE. We will have oral presentations or viva voce, and we will have personal and professional development ethics, lifelong learning skills, evidence-based medicine practice, communication skills, teamwork, and entrepreneurship. How we are going to achieve these compile the results for these components. We need to use different types of questions. So we can use multiple type choice questions, multi-response questions, subjective or essay-based questions, audio response and questions. This is especially useful in online assessment, and then project and case-based study questions. Here is a very simple example how we can do written examination with the available resources in the campus. This might include multiple choice questions, modified essay questions, or structured essay questions. We divide the students in groups of 20 to 25 members. Then for each group, we assign an invigilator. We use the Zoom, for example, or you can use other methods as well. But we ask the students to switch on their camera, and their mic should be unmuted so that we can see them as well as we can hear what is happening there. We can use Google Forms or similar forms for answering each question. Then we project the questions online, and there is a submit button. For example, we are projecting the question on the Zoom screen, and students are answering on a sheet similar to a Google form, and there is a submit button on each page. So once the question is shown on the screen, student would write their answer on this sheet, which example is Google form, and then submit. And then they would not be able to go back on that question. Then they move on after fixed time, means each question there is a specific time, and then we move on to next question. We can use videos, images, and sounds. That is an additional benefit of online assessment, that in this we can, let's say, play videos on the Zoom, or show pictures, or we can use sounds, and we have questions based on that, and students are answering on that form and then submitting it. And this system would automatically mark the responses because we would have given the model answer in the software. So this is a very simple example of written examination online without using much of resources from outside. There is, to complement this, there is a two-device online proctored examination. In this system, we use two devices for online proctored examination. Means that we are proctoring live for an exam using two devices to enhance the security and reliability of the online examination. Student will require their laptop or computer, a desktop to take the exam, and an additional or second camera equipped device, which may be another laptop, tablet, or even a smartphone, to be placed behind the student to ensure a 360-degree view and a more secure and fair online examination. This means that student is using two devices. One is a laptop or desktop where they are taking the exam, and another device with a camera, which may be a smartphone, to show the surrounding. Here is an example or elaboration. Student using a smartphone and a laptop, and this is how it looks like. Now here student is answering on the computer, and the phone on the side is showing the view, and here are the invigilators in a control room. Each invigilator is looking at their group of 20 or 25 students, and they can communicate with the students, and if they have any doubt, they can ask the student to show that area by using their handphone. So in this way, the student has to use two, let's say, identities to register for this. And by using these two devices, we can monitor their written examination in small groups. We can also ask for assignments, projects, and literature reviews. For example, vaccines for malaria, dengue, or the latest modalities of treatment, etc. We now open book or open web approach. Nowadays, it has become very doubtful, especially with the use of AI. So we must have the system to check for plagiarism and use of AI. So whatever assignments we are giving them as a part of written examination, they must be thoroughly checked for plagiarism or for whether they have used any artificial intelligence facilities. The additional features of online assessment: to enhance the content validity, following additional features can be added to online questions. So these are features or characteristics which need to be added to the questions. We can have animations, videos, and sounds, and this is additional benefit of online assessment, which is not cannot be used in the traditional way. Hotspot questions, which require students to identify a structure by placing a mark anywhere on an image or a diagram, especially, for example, if we are using anatomy specimens, and we can ask them to identify certain structures in that. Dragging labels directly over an image. So we have an image and we have the labels on the side, and then we can ask them to drag those labels on the correct part of the image, or we can use simulations. Another method the close or text number entry, it is actually revisiting an old method. Close is the technical term for inserting deleted words into the section of text in order to complete it correctly, and hence for assessing recall of factual information. So it is actually the practice of fill in the blanks, which may be the words, phrases, or numbers into a section of a text or a designated text or numerical box, or it can be missing points in a flow chart. But that is not all for this, because it can be used even for more than recall of information. For example, we have data and we can ask them to interpret the data. We can ask them to come up with a diagnosis based on the data. We can ask them to come up with the drug of choice for the given scenario, or we can ask for the mode of action of a certain drug. So these are few examples. So although to begin with, it seems a very simple fill in the blanks form of thing, but it can be used for higher functions or higher levels of Bloom taxonomy in assessment. Here are a number of free online examination softwares which can be used. As I said earlier, that we must try them. There must be a trial run before we start using the softwares. Here are some more. So there are numerous softwares available on the net, and they are free. Many of them are free, and we can choose one or two of them and get familiar with them, and we can train the staff and the students in use of that software, and that we can then apply for our online assessment. Right. Now, that was for a written examination, which seems relatively easier to be done by using online assessment. Now, how to assess the practical and clinical examination? For practical or clinical examination, we can use pictures and labels. We can ask them to label the structures, identify abnormal structures, data plotting and interpreting, for example, growth charts, statistical analysis, demonstration live, or videos where and we show them video and ask if there was any mistake, for example, in that video. Showing videos and asking for diagnosis and description of abnormalities. Here I'll give some example for such assessment. In anatomy, for example, we can ask them to label anatomy pictures, identification of structures and related questions, which would be practically what we do during OSPE. Then we can have the abnormal pictures and ask them to identify them, or we can frame questions based on that, like Erb's paralysis, kyphosis, lordosis, or chest deformities, etc. We can use histology slides and ask them to comment on the findings and identification of the tissue. We can use radiographs, bones, fractures, cardiac shadows, lobes of the lungs, fissures, videos of movement, normal and abnormal, and muscles involved, or video on dissection can also be used. For physiology, biochemistry, and pharmacology, we can use graph interpretation, data or finding interpretation, flow charts, missing points, drawing a feedback mechanism. For example, in a patient with hypothyroidism, so the feedback mechanism. Our videos are animations, or we can have slides of, let's say, RBC morphology or thrombocytopenia or abnormal WBC in their slides and frame questions on that. So we show these slides online and frame questions on that. And if you follow the very first example I said, we can show these slides on the screen, and then the questions are on the sheet, and students would answer those questions and submit. For microbiology, we can use pictures of microorganisms or gram staining. Culture plates are mediums. Slides like malarial parasite or bacteria. Pathology, again, pictures identifying the gross abnormalities. Histopathology slides, abnormalities, and giving a diagnosis. Or urine microscopy, for example, RBC cast, etc. Now, here is an example giving a slide and then giving a scenario and then asking students to make a diagnosis. Here is another example. We have two pictures. This is a normal heart, and this is an abnormal heart where there is a ventricular septal defect. And we can ask students to fill in the pressures and oxygen saturation in the chambers of the heart based on this abnormality. So in this way, we can assess them in these areas. Image hotspots or Quizmaker is another software, and image hotspot type questions are good at assessing visual knowledge that would be difficult to achieve through a multiple choice question or other textual question types. In such questions, there are no visual cues as to where the correct answer is, and there are no discrete distractors. So each pixel may be a potentially correct or incorrect answer, and student has to point that by moving the cursor. We can use the pictures of gross specimens, slides, or photographs as well. Now, coming to the OSCE, as you said, I have, as you see, I have written here is a compromise because it would not be exactly of the same standard as we have face-to-face, but we can use the growth charts. We can use the facial features like Down syndrome or thalassemia. We can use the dental changes, marasmus or kwashiorkor, nephrotic syndrome, eye changes, jaundice, retinal changes, goiter, hypothyroidism, gynecomastia, abdominal distension, etc. So we can even use the ambiguous genitalia or rickets, swollen joints, achondroplasia, talipes, purpura, ecchymosis. These are few examples. You can find a lot more examples in your related area. My examples are more towards the medicine because that's my field. Now here are the actual example. So we show this picture and ask the students to identify the abnormal features they might notice in that. For example, here the child appears silenced, and then with that picture we give an X-ray, and combining the X-ray chest and the picture of the child, we can ask them to come up with a diagnosis, and then they have to justify their answer, and we can ask the related questions. Here is another example showing this picture and framing questions based on that, which you can do a lot better than me. Here is another example. You can see the hyperplasia of the gums, etc. And then we can show these these pictures online and frame questions, and student can answer on the sheet and submit within the specified time. Here is another example of picture and then framing the questions on that. Now, apart from pictures, the slides, etc., we can also use videos in OSCE. We may show the gait problem, we may show the chewing problems, we might show the fits or epilepsy, we can show abnormal movements, our physical examination, the cranial nerves, our facial palsy. So we can use a number of type of videos in examination, but as I mentioned earlier, it should be our own creation and not copying from anywhere else. So we would need resources to develop these kind of materials. The ability to deliver moving images to a student during an assessment considerably extends the scope of question formats. I think this is the big advantage of online assessment on face-to-face assessment, because here we can use these materials which make the examination more valid. Videos of patients, doctor-patient interactions, procedures, consultations, communication can all be used to create appropriate assessment scenarios that have high content validity. Apart from that, we can use audios as well. For example, heart murmurs, or we can use the respiratory sounds, lung sounds, or other sounds, and we can frame questions on that. The mannequins, if, for example, students are remotely placed and there is any center there which has mannequin there, so we can collaborate with other institutions at distant places where they have, let's say, clinical skill labs, and then we can organize examination on the mannequins at remote place with collaboration of other institutions. The interviews and communication skills can easily be assessed online. We can use simulated patients, we can use real patients, we can have counseling sessions, ethical dilemmas, prescription writing, etc. So these can be done very easily online, and the assessor can assess the student on the spot. The same concept is in dogs and drugs package. The student takes the role of a physician who has to deal with the patient, who present with a clinical problem by virtually taking the history, performing a physical examination, and ordering further tests. This is in form of modified essay question, which is similar to this software. And here the results are presented as a text only and by integrated multimedia elements. Now, we have gone through the, let's say, how to assess the written examination, how to assess the psychomotor skills, and also to the communication skills, the attitude. But exam security is a big issue in online assessment, and how to address that. Now, there are a number of methods which can be applied. For example, the flow of questions is controlled by the examiner and not by the student. So if we are like the first example I gave, if we are using the Zoom and we are projecting the questions and students are answering on a sheet like Google form, then the flow of question is controlled by the examiner, and after a fixed time, the examiner would move to the next question and student would press the the submission button, and he or she would not be able to go back. Just sufficient time for answering. Students do not have access to the answered questions. Invigilation by using camera and mic. Tallying the results with the previous assessments. And viva voce of outliers, as I mentioned earlier, that those who have excellent results are those who have very poor results, are those who complained of internet disruption. They can be reassessed by viva voce examination. And definitely we need to check for plagiarism and use of artificial intelligence. Here is another idea. The videos of physical examination prepared by the student by evaluation for evaluation by examiners. This we have practiced, and we, especially during the COVID time, we asked the students to prepare some videos and then share with us, and we evaluated on those. They were asked to do certain physical examinations and record it. They may use the family members, or there may be a group of 2 or 3 students who are in the same vicinity, and they can create such videos. And some simple procedures can be assessed in this method. The other method we use during COVID was that the examination by using personal protective equipment. Right, now what are the advantages and the challenges of online assessment? The advantages of online assessment for students: students can easily monitor their own academic progress by means of formative assessment. So because the student would have it available around the clock. Answers can be entered, altered quickly and clearly. Assessments can be modified to accommodate special academic needs, because sometimes they have to have the individual approach in assessment, especially the formative assessment. Interactive, adaptive, and multimedia question type possible with high validity. The advantages for academic staff: questions can provide a more valid and holistic way of assessing knowledge. They can monitor the assessment of students to give personalized feedback. That is again a very big advantage. And interactive, adaptive, and multimedia question type possible. These multimedia type of questions which are not possible in face-to-face can be used online. This may be distant online or on campus online. For advantages for staff of fast marking, because the softwares can mark the question immediately, and of course it saves paper. Here is the summary of that. It reduces the burden of administration, extremely environmental friendly, marks results quickly, easily accessible to everybody, and can have greater security in certain aspects. Is an online examination system safer than a traditional examination system? Yes, partly yes, because as I mentioned earlier, that everything in examination cannot be assessed online. So we can look at the possibility of combination of online as well as face-to-face assessment. So certain areas which can be assessed online safely with security should be assessed in that, and the areas which are important but cannot be assessed online can be done physically. So enhanced safety and privacy saves money, time efficient, saves paper and technological advances. Having gone through those advantages, of course, there are some disadvantages as well. Cost is one. The assessment system software license may cost a significant amount of money, and their maintenance, then use of powerful servers, large number of computers may be needed. But if students have their own computers, that can be used. Staffing and physical environment, especially the computer labs would need specific environment. We need to train the students as well as the staff for using such methods, and this can be done during formative assessments. Staff must be trained in how to enter questions and utilize the full capabilities of the system, and the risks of external hackers and viruses is there, and the internal staff or student security policies need to be instituted, and failure of power or hardware or software means the disaster recovery or that the whole system needs to be in place. I think with that, I complete my presentation, and if anyone has any question, I will be happy to answer that.
Sir, thank you for this wonderful presentation. I thought when I discussed about this topic to you, I think you readily agreed. I was wondering, sir is not thinking about it. It's all about, virtual assessment. I don't think so. You even flinched and you said, yes, I will take this topic. And people are fearing about the assessment. People are worrying about, how do we assess? And as we constantly, wonder on this topic of the assessment, I think there was one interesting feedback which came into our system that, males are favored more than the females while giving the marks. So you're able to hear me?
Males
So how do we answer, circumvent this type of feedbacks? If you have come across any of these things.
I mean, so basically, let's say, yes, when you are invigilating and you are looking at all types of students, but I don't think we have any problems such that males that there is any discrimination between male candidates and female candidates with the if the marking is in the system itself, so human element is not there. So I was giving the simple example of, let's say, the Google Forms, and the Google Forms, if we add the correct answer, they can mark for us, and I don't think system would differentiate between male and female.
And also, sir, how do we, this question also came, how do we assess the skill component in a virtual exam? Because dentistry is all about skill. So these questions are also asked by many people. How can we assess the skill component virtually? Are you not?
No, I mentioned very clearly in the beginning that not all the hands-on skills can be assessed online. We have to see the limitation. Of course, when it comes to the skills, somebody might demonstrate online, but it would not be equivalent to face-to-face. That is why I think we should have a combination. We see a lot of advantages of online assessment. We should utilize that. So part of examination can be online, and the other part where it comes the hands-on skills, of course, we if we do it online, it would be compromised. So it definitely, especially in this field with the dentistry, where you need to see their hand movements and the skills, the uh, I don't think online can answer that.
Yes, sir. As you said clearly, we need to define what is the objective of our examination, and if the objective of the examination is only to check the communication skills, definitely we can plan some of the activities for online assessment. And as you rightly said, you have pointed out, but still, when we talk about going virtual, and if you see our new education policy, it tells 30% of the syllabus try to do it online. That is what they are trying to push. Rather than going everything didactic, at least push your 30% of the syllabus into online mode of learning. And we are all wondering, how do we do it, how can we proceed forward? And of course, doing is one thing. When it comes to assessment, how are we going to plan for it? I think your topic today has given us the basic guidelines on how can we go about doing these things. Now I keep this platform open. If any one of the attendees want to ask any questions, you can open up your mic and ask the presenter the question. If any one of the attendees would like to ask any question. So personally speaking, if there are no, personally speaking, sir, what is your, the final say? Like, can we incorporate in a say that, internal examination which we conduct around for that? Or you think that, for a summative, some part of the, either a 10 marks or a 20 marks in a summative in the final, can we include virtual based examination? I'm talking about in India, we have internal examination and the final examination. So can we incorporate that on a percentage basis?
I think you can, especially, for example, the written examination. Even if you are doing on campus, not necessarily the students are sitting at their home. They are on the campus, they are in the examination hall, but it is being conducted on the computers. So in that way, there are a lot of advantages. For example, you can use the videos, the moving pictures, which you cannot do otherwise. And so even on campus, it can be online, but that gives you extra leverage of using additional type of questions, and the system can mark them straight away. So that can save you a lot of trouble and the time and the energy, as well as the wastage of paper, etc. I'm talking about, it's not necessarily that they are distant. They are sitting in the campus, in the examination hall with their laptops on, and you can do that. So it would be online, but at the same time you are invigilating them. So that can be helpful. In that sense, I think we should take advantage of this technology in our favor.
Sir, and also I know that I'm putting you in the tough questions, the general questions. We do hear that how can you allow mobile phones in the examination center? What if they toggle between and find the answers and write the answers? How do we answer or toggle between these? Because our examination halls, we have put mobile jammers, and I don't know, physical examination also we do during the examination. How do we tackle this part of the things if you're going for online examination where they're using the devices?
Okay, now when we use this online examination, the written examination, the system is such that if they open anything else, the exam sheet would close. So they cannot open any other software or any other application. As soon as they open anything else, this sheet would close and they would not be able to access it again. So that security is there. But if we talk about expensive, proctoring methods, they can even monitor the eye movement of the student and can inform the invigilator. So actually these are not very extraordinary things to, for example, we are using the, like I said, everybody is familiar with Google Form, right? So, and we have only, let's say, 1 minute to answer the question. Student answers the question, press the submit button and moves on to the next question. There is no time for them to do any other movement. And even if they try, the system would block them. So this is quite easily controlled.
So thank you, sir, for elaborating the answer. I know as a moderator, I'm asking very basic question, but these are the fears which are inherent in majority of them, how an online exam. So I am just trying to provide a different perspective. I know majority of them have listened to your lecture, and I think these are the questions which were asked. Basically, the skill component. How can we make sure that the system is robust? I think you have given us enough ideas and the guidelines which we have to follow. I think if there are no further questions, sir, we would like to
just
thank
want
you.
to share another point that actually
Yes.
we had asked our students to do certain examinations and make videos and send to us, and we had very interesting experience on that. Doing let's say student doing examination on his younger sibling, making a video and sending to us. It was not only for assessment, but teaching also. Once they are making a video, of course, they need to know minute details. So, and we use it for formative assessment, not for summative assessment, because it has a lot of teaching element in that as well.